tincture of opiate.
Hey, welcome to Draper Harper Cocktails and Conversation. Dr. Harper, we've done this a lot of years at Valentine.
Yeah.
We're going to do it this year online. I think the response has been overwhelming that people would rather watch from home than go out to Valentine, even though that was fun.
Right. They don't have to worry about whether or not we're going to provide them with a good drink. They can make their own drink at home and drink exactly what they want. They don't have to get out. Oh. They don't have to drive, no traffic, no nothing, and we'll give them the same information and hopefully answer all their questions and let them know a little bit more about our services, and hopefully it'll be a fun evening.
Right, same program, same information. Later on, the skincare gals are going to talk about skincare, the new RF microneedling, yes, the hair removal laser that I can personally say works.
I can too.
And painless, which was always that thing hurt like crazy in the past, but now it's easy. And then we're going to have the injectors talk about Botox and fillers and all the latest stuff. So latest stuff in surgery that you're doing. What do you want to talk about? Latest breast aug?
Well, normally at these seminars, I talk a lot about the breast and body. You talk a lot about the face and eyes and everything, and it's important for our patients to know that we both do all of those surgeries, but I think that's just how we've kind of gotten used to splitting things up. But from a breast surgery standpoint, yeah, there's lots of changes in the last several years. You know, the newer implants, these gummy bear implants, they've continued to improve them technologically, and so they've gotten to the point now where they have some devices that don't ripple as much.
There was a deal with gummy bear where they were bad for a while. Tell them about that.
Right, so there was a subset of the gummy bear devices that were textured. It was only the textured devices that we're not using anymore. We haven't used for probably 5 years.
But you still use that same cohesiveness,
right?
Just not shaped with the texture.
That's exactly right. So the textured was just for the shaped devices, not the round devices. And those shaped devices, you could imagine that if they weren't held in place perfectly, if they just kind of rotated a little bit, it could get cockeyed and you'd have like a very awkward shaped breast.
If it mattered, that'd be really important.
Right. So now we've got that same cohesiveness, that same gel that it's not that liquidy kind of molasses fill. And so now we've got that in a round device. And so what it's allowed us to do is it's allowed us to do above the muscle augmentations and even above the muscle reconstructions. So if the vast majority of us in the breast reconstructive world have gone to above the muscle reconstructions, and we're getting such beautiful results that, those are on women whose breast tissue is removed. So if we can get beautiful results with these implants on those patients, we can certainly get it in the cosmetic patient realm. I actually kind of took a screenshot, and there's no way for me to like pull it up or anything, but I took a screenshot of, I think, something that came through our Instagram account, and it was another plastic surgeon that was showing a before and after result, and it was horrible. And I couldn't believe they put it on there, and it was an under the muscle augmentation that looked so unnatural, because that's where people get it wrong. I mean, people come in and they say, well, I heard if we put implants underneath the muscle, it's going to look more natural. One of the best breast surgeons ever, Rod Hester, who has since retired at Emory, but he was the chair at Emory for forever in Atlanta and was my chairman for my first couple of years there, used to say, if God intended to put the breast underneath the muscle, that's where he would have put it. And so he put everything above the muscle. I'm not saying that's necessarily the right thing, but there is this kind of whole mantra that people come in and say, well, my friend's got augmentations 5, 6, 7 years ago. They're all underneath the muscle. And that's true. I was probably 90%, 95% underneath the muscle 5 or 6 years ago.
And where are you now?
I'm probably 75, 80% above the muscle now. I'm even moving a lot of people who are below the muscle on top of the muscle. And it's really allowed me to let the implant do the work. Creating a natural look is about choosing the right implant for the patient.
And how about mammograms? People worry about mammograms and implants. Speak to that.
Yeah, so I actually wrote a book chapter on this, which is pretty great. I was in residency and got asked to write a book chapter on breast imaging in the previously augmented patient for a book that Kirby Bland, who is a surgical oncology chairman over at Birmingham for forever, had us write. And when we looked at the data, you looked at breast visibility on mammogram, and it was 95.5%, somewhere in there, that you could see that much breast tissue on standard mammograms. And then they looked at below the muscle augmentations and above the muscle, and there was no statistical significance in the ability to detect. I mean, newer mammographers, new age techniques have been developed to where they can really ship this implant out of the way and get full visibility. I've rarely ever heard of a case where a detection was delayed or they didn't come across something because the patient was augmented.
So the issue of mammograms has been taken off the table. It's certainly easier for the patient to do it on top of the muscle. How about body size? Is there any limitation in terms of putting it on top, being too thin, too heavy?
So you certainly run the risk, the thinner you are, of having, if you choose an implant that has a high profile, you will have a more augmented look, you'll have more cleavage line that you can see, but there's certainly your patients that have a particular shape to their pec muscle. I mean, some people have very thin, flat pec muscles, some have really well-defined pec muscles. So if you lift that up and put that on top of an implant on the upper portion, you can actually have somebody lose that kind of natural slope to their breast. So, it's really a per patient basis. And so the most important things are to take some measurements, make sure you're not choosing an implant that's too wide or too narrow for that patient's chest, and then start asking the patient, how much cleavage do you want? How much kind of side boob do you think is tailorful? Tailor it to what they want. We had a person ask on this, are salines a thing of the past? I mean, yeah.
For me,
yeah, they really are. I don't think I've put a saline implant in 7 or 8 years. And it's typically somebody who has...
And mechanically, the warranties are not there. These are lifetime warranties on the implants.
Right.
So saline, you can't get that, and it's a much more unnatural feel.
You can't. I think one thing that people oftentimes don't understand is that, what your body sees in an unruptured implant is the silicone shell, no matter whether or not it's saline or gel. So it's the same kind of thing. What worried people, and I understand this, I had 2 cases today where I pulled, 35-year-old implants out of someone, and they were encapsulated, they had ruptured, which was a problem, especially with that first or second generation implant from the 1980s, 1990s. These new implants don't do that. So when we go over safety profiles with patients, I let them know the gel implants now are safer, they have less rupture rate, they're gonna have less kind of effect on your body because the gel stays right where it is. The saline devices, every time you take a step, there's this kind of inertial water hammering effect of the implants that I think has a wear and tear over your body over time.
It also has an unnatural feel.
Yeah, it does. So do implants need to be replaced after a certain number of years? No. There is no shelf life on these implants. And a lot of times the statistics that they tell you, every 10 years you got to do X, Y, or Z. They did studies in the past, and they took all comers, they took, hundreds of different surgeons. And so like anything in life, some surgeons may be a little better than others or have different techniques. And so I think by using current techniques, current safety measures to make sure that we don't get encapsulations, infections, and not just putting in, really large implants, and really talking to patients about the merits of choosing an implant that fits them, that can get them the result they want without putting them, in potential harm's way down the road. These implants can go to the grave with you. I mean, that would be my expectation for the majority of my patients. Now, women can still get implants when they're young and have 3 kids, and then all of a sudden, their breasts change and they need to make adjustments to either their implant or their breast tissue. And I don't consider that a problem with the implant or from the implant or an issue with the implant. And, a lot of those patients, they were rolled into these statistics when people used to say, a quarter of all implants have to be exchanged or patients go in for a second surgery by 10 years. I'm just not seeing that, and I don't anticipate that we're going to see that going forward. There's no shelf life on them. They can last as long as you kind of make good decisions and take care of them, and you don't have major fluctuations in your weight or the size of your breasts. And so, no, there's no shelf life. You can last forever.
Now, I have seen a pair of implants in a patient that were 33 years old, and they look fantastic.
Yep.
Soft, look great, felt great. And as long as they look good and feel good, there's no reason to change them. But I've also seen some implants in at 42 years or 45 years. They were awful.
Yeah. Yeah. And I think we have some Instagram videos or some that are coming up that go into detail. And I think it actually has me kind of cutting into a capsule where you can see that older implant.
Look forward for that Instagram post if it's not already.
Yeah. We got another question about how can you decide on implant sizes with women that have two different breasts? Kind of funny, because literally my third case today was this. And this young lady's breasts were different by, a cup and a half. And so thankfully, we approached the dissection the same. And then we've got a bunch of sizers, which are temporary devices that are placed in the pocket, and then we can sit the patient up and make adjustments. But really, you just kind of tailor it to what are the differences. Is the smaller breast narrower, and so we might need a wider implant to make up for that lack of width? Does it project less? Does it project more? And thankfully, there's so many different profiled implants and so many different base widths that we can get things a lot closer for patients. Sometimes it requires, doing an adjunctive lift or something like that to make sure that the nipple position is as perfect as possible. But this is actually way more common than I think women think. It doesn't exclude you from breast augmentation if your breast size before surgery is way off.
Well, actually, I would think makes you more of a candidate for it to try to even it up.
Absolutely, I think so. I think some people probably just assume that their only option is to reduce the larger breast.
You can. Now, if you've got a large breast that you really don't even want, that is that big, you could reduce one side, maybe lift the other,
right,
to even them out. But having disparate breast sizes is a problem in clothes, certainly in bathing suits.
Sure.
That is a fixable thing that you can't do with diet and exercise.
Yeah, so it's great. We're getting a ton of questions, which is really neat. Somebody asked, is 60 too old for implants?
Oh, definitely.
Definitely not. My second patient today was 64 years old, and she looks amazing. And so no, right? 60 is the new 30, new 40, depending upon how good of care you take of your skin.
All these hard body 60-year-olds.
Hard body 60, right? It's good for you. Right?
Totally. I'm married to one of them.
You are married to one of them. You're a lucky dog. A lot of questions also kind of about how to take advantage of the specials. And I think some people will probably go over that with you. We don't really know it too well. But we talked a little bit about breast surgery. Why don't you tell us some of the new things that you're doing with facelift or brow lifts or eyes or any of the new stuff that's kind of happening out there? I don't want to take up all the time.
Well, then you go with what the questions are, but facelifts have evolved just like breast surgery's evolved.
Sure.
And aging comes in forms of problems with skin, problems with the muscle, problems with the fat, volume problems, which is why fillers are important, and then quality of skin. So you kind of have to address all 5 of those issues if you're going to get a complete rejuvenation. And when a patient comes in, you evaluate what their goals are, what they actually have, and make a plan for them. So with facelifts and neck lifts, you're going to make a trampoline under here, which was a natural trampoline when you were 25, 35, maybe even 45. And then it starts deteriorating and you start seeing bands, and then the skin moves at a different way than the muscle does, and there can be extra fat. So you address all those problems and cut the muscle in a way that allows that trampoline to snug up, and then pull the trampoline tight, in a procedure that's done here in the office in about 2.5 hours, with looking good for many in a week, especially with a hairstyle. So that the goal is to look refreshed and natural and presentable, but not as good as you're going to be at a week, and then probably presentable for weddings and major parties at 6 weeks. And I think that's doable.
So you started talking and you got a lot of questions. You ready to
Boom,
answer?
boom, boom, boom.
Bam, bam, bam. Does anybody do lip lifts?
We're doing a lip lift tomorrow, and there's a measurement, a known measurement that corresponds with a youthful upper lip, and getting long in the lip is a phrase from the 1700s, and it actually turns out to be true. So yes, there are lip lifts. It can evert the lip a little bit. It makes it more youthful.
Right.
It's a simple thing to do.
So a lot of you probably don't know what that is. So you're talking about the distance between, right at the base of the nose and the red part of their lip. This lengthens as you age.
Absolutely.
And also allows kind of the lip to curl in and makes the lip look a little bit thinner, right? Like part of your lip's actually kind of hidden underneath inside your mouth. So this lip lift procedure is an incision that's hidden at the base of your nose, and then you remove whatever excess tissue up until this measurement you're talking about.
Exactly.
And then just bring it together, and it's concealed right there.
And it shortens this distance, and it everts the lip a little bit, so you get more lip show.
Love it.
And it works nicely. And if you need volume in your lip, you can put that in at the same time. We don't do a lot of fat grafting in the face. Dr. Harper uses it effectively in the breast. But in the face, it is a insufficient survival rate of the transfer to make it reliable, unlike the fillers that are reliable 100% of the time. And if you don't like the volume for whatever reason, you can remove it with a filler instantly, where fat grafts, you're not going to get what you want. And if you don't like it, it's hard to get rid of.
Yeah.
So that's why we stay with fillers. New things in brows. The endoscopic brow lift's been great for a long time. It's a small incision. You do everything with fiber optics, and lift the brow so that you improve the shape of the brow, improve the upper eyelid. Pretty standard stuff. Quick recovery.
So a question about that came in and said, anything new with Bless? Is there a different strategy in someone who's 44 years old versus someone who's 70, and what's the average downtime?
Well, like anybody, you make a diagnosis to what the problem is, and then your treatment options are based on that diagnosis, really not on the age.
I'll also say some 44-year-olds look like they have 70-year-old eyes, and some 70-year-olds look like they have 44-year-old eyes.
Yeah.
So, and you talked a little bit about a neck lift, and this particular patient, prospective patient, wants to know, how does she know if she needs one? So what's something she can do in the mirror to check and see if...
what we often hear, and you've heard this too, is when you've taken that selfie and, you're not doing it down here, you're doing it up here to stretch the neck out.
Right.
So if you're seeing banding in the neck and that loose skin when you're looking down, you don't like your profile, then it's time to come talk to us and just see, are you ready? And we may say, there are other things you can do, you're not ready for that, or maybe it's time.
Yeah, and one of the most important things about it is making sure that your skin is the greatest quality that it can be prior to surgery, right? Because we can get a really nice result on the table, and then if that skin isn't good quality and it stretches out or it loses kind of some of its luster, then you can go back to kind of having a suboptimal result. So the most important thing, just like we tell patients with breast and body, get in good shape prior to surgery. Don't have your surgery get you into good shape. Do everything you can to prepare before
Be a good
surgery.
Candidate.
Be a great candidate.
Good candidates
be healthy
get good
and take care of
results.
yourself.
Poor candidates get poor results. It just makes sense.
Yep.
We've got some good estheticians, don't we?
We do, and we need to get to them. There's a bunch more questions for us, and we're happy to
meet you in the parking lot.
Meet you in the parking lot, or you can email us, or we'd love for you to come in and have a consultation. Just call the office, 704-375-7111.
Operators, glad to take your call.
Speak to anyone. Yeah, you can donate to whatever charity you want as well. But we are going to roll this over to our estheticians now, right? All right, perfect.
Angie Thomas at Graper Harper Cosmetic Surgery, talking about Halo today. It's a BBL and a Fraxel combined, very powerful. The BBL is treating pigment. The Fraxel is treating texture, pore size, fine lines, and wrinkles. With this procedure, we do numb you for about 30 to 45 minutes. It also can be used in multiple areas, most commonly used face, neck, and chest. There is a little bit of downtime with the halo. You've got about 7 days. When you leave the office, the skin feels mildly sunburnt for about an hour, and then you've got some swelling for the first, I'd say, 48 to 72 hours. And then you get almost a sandpaper texture to the skin where that pigment is lifting off. But really, a powerful tool for aging and for pigment. So send us your questions.
Okay, hi everybody, I'm Candace. I'm going to talk about BBL, that stands for broadband light. This device right here, it tackles pigment and vessels. So if you have sun damage on your face, neck, chest, hands, arms, what this does, this light snaps around on the areas of concern. It turns the pigment darker, looks like little ground pepper for about a week to 2 weeks, and then it falls off. As far as the vessels, if you are covering up redness with your makeup or you see little squigglies in your magnifying mirror on your cheeks, this is really good for the vessels. We cannot do this treatment when you have sun in the skin. So during the months of spring and summer, we don't really use this device. So come see us now if you're interested.
Hi, Carla Smith here with Graper Harper Cosmetic Surgery. Going to talk a little bit about microneedling today. We utilize the skin pen device by Bellis Medical, and this is to help with overall skin rejuvenation. We treat lines with this, we treat acne scars with this, we just treat the signs of aging with this. So it all leads to better skin texture, smoother skin, refreshed skin. The device works by creating these microscopic channels in the skin. And those little micro injuries stimulate the skin's own natural repair response. So that in turn leads to increased collagen production and elastin production. So the skin overall looks much healthier. We love this device because it is safe for all skin types. The device is also utilized for any surgical scars that might be apparent after surgery, so we are able to use it for that as well. The procedure takes about 30 minutes to an hour depending on the treatment areas. For example, skin rejuvenation, we might be treating face, neck, and décolleté, so that may take an hour for the procedure. It's quite comfortable. We do put on a topical an anesthetic prior to the procedure. Downtime is quite minimal. Most people return to normal activities within about 24 hours. Sometimes the skin can remain a little pink, but again, very little downtime, so it is a great reward with minimal downtime and recovery. Melissa's going to talk a little bit about the difference between medical microneedling and microneedling with RF, which is radio frequency.
Alrighty, as Carla said, this is our new Morpheus 8 RF microneedling, radio frequency. So this is microneedling on steroids. You're going to want it. Okay, what this does, as well as pores and lines and scars, this also kind of lifts and tightens the skin a little bit. So for those of us that are not spring chickens anymore, this is one of the great new procedures. I think this is our favorite new toy in the office right now. So when you come in, we do have to numb you. You get to use a little laughing gas because this, again, is microneedling on steroids. So there's a little bit more discomfort, and because this goes deeper, that goes up to 2 millimeters. This bad boy can go up to 4 millimeters. And then it bursts a little heat under your skin so it shrinks that collagen. So you're gonna feel a little love when we do this. So we'll give you a little laughing gas to help with that. Downtime is about 48 hours before you're into makeup. After that, just tootle on with your life. This will help again lift and tighten. With deeper surgical scars, it's very efficient. It ablates tissue, so if you've got some fat too, we can burn a little bit of that wherever it is on the body and tighten the skin. Call us. We'd love to tell you about it. Alrighty, we told you just a little bit earlier about our Morpheus 8 RF microneedling. Now we're going to demo my lovely little co-worker here who is so concerned about the aging of her neck, okay? Easy peasy. She's sipping on the Pronox, which will help with pain control. Discomfort control is what we call it because it's really not that bad. We took the numbing cream off, so she's ready to go. And away we go. righty, we've just finished the first pass of many on the neck. Easy peasy.
We get asked the question all the time, the difference between going to a spa and having a facial and coming here and having treatment. And we get asked this in our rooms daily. There is a place, I feel like, for both. If you're traveling with your husband and you want to have a facial at the spa, go for it. But the medical grade treatment that we do here is supervised by our doctors, and so it's a game changer. I feel like the results are just much more grandiose. What do y'all think?
Absolutely.
It's
Absolutely.
like going with a personal trainer rather than walking around the block by yourself.
Oh, that's
It
good,
amplifies your skincare above and beyond. You'll look way younger, way fresher. Your friends are going to think you had surgery and all you had was a little skincare.
Right.
And
Right.
as far as the products, we have 20% off on our skincare products, so take advantage of that.
And there really is a difference when you talk about, over-the-counter products versus medical-grade products. When you're looking to rejuvenate the skin and get it in a healthy-looking state, and if you're concerned with brown spots and fine lines and wrinkles, getting on a medical-grade product is a game changer. Those products are regulated by the FDA, whereas over-the-counter products are not. And really, medical-grade products are going to make the biggest difference. You're going to see changes in your skin when you're using topicals such as Retin-A, retinol, growth factors, and peptides, things that we know are proven by science to work in the skin. So that really is a big difference when you're looking at over-the-counter versus medical-grade products.
And they're all 20% off.
Come see
And
us.
real quick, caveat. Summer's coming. Don't stop your skincare or your peels. We can still peel you. We can still do some of these treatments in the summer. You may be on vacation, but your skin is never on vacation. So don't stop
Right.
coming and getting your skincare. We can adjust it for you accordingly.
Absolutely.
I'm Angie Thomas. I've been with for 24 years. To my left, I have Melissa Myers, who's been with us for 21 years. To my first right is Candace Workman, who's been here for 15 years. And then to my far right is Carla Smith, who has been with the practice for 20 years. So you can see that we have quite a bit of experience. We're so grateful for you to join us tonight. We're ready for your questions, so let us know what you have for us.
All right, so the first question that I saw was, how much is the Halo laser?
Okay, so Halo is for full face is $1,500. We do run specials occasionally, so you can look for those in the near future, but $1,500 for full face.
And then Kathy wants to know, what was the treatment the second woman talked about? So I'm thinking you're talking about me. I was talking about BBL, and that is for pigment and vessels. That is anywhere between $200 to $400 on the face, and for the body, it can be a little bit more. So the next question is, do you have a treatment for blue facial veins, like the temple area?
Well, we really don't treat those. That's kind of out of our scope of practice, so we would send you to a derm for that. We really treat red vessels, little telangiectasias around the nose, little cherry angiomas. So I'm sorry, we don't treat those, but we can refer you to somebody.
How long do the effects of the needling treatments last?
I think microneedling treatments, are we talking about skin tan, or are we talking about Morpheus, or just regular skin tan? So I think that skin tan treatments, I think the best results are seen when they're done in a series of about 3 to 6. I think that doing those regularly, every 4 to 6 weeks, makes a big difference. You can also alternate those with chemical peels for very good results. And I like to tell patients that when you choose something like microneedling, or you choose something like Morpheus, think of that as we're resetting the clock. So your results are going to last as long as you're doing good skincare at home and you're coming in for regular skin peels and things. Your results are going to last longer. Now, if you did regular, skin pin treatments or regular, just traditional microneedling on its own, I think the results are going to last for maybe a year.
So Carla, Leslie asked if trying to grow skin collagen, is it better to do straight microneedling or microneedling with RF?
I think they're both wonderful. I think if you are just trying to do some good collagen stimulation, that microneedling, traditional microneedling works for that. I think if you are trying to grow collagen and trying to treat a problem with laxity and maybe slackening in the jawline or loss of elasticity and laxity, then I think Morpheus 8 is the better treatment for that.
Yeah, I think
Absolutely.
I agree with
We
that.
all agree
And we
with
just came back from an advanced class with Morpheus 8, so we were in Atlanta just learning more about how to treat the face and how to treat the body with some advanced settings. So yeah, we're ready.
So 3 to 6 treatment. Yeah,
3 to 6 treatments.
The RF microneedling does a little bit less treatment protocol, about 3, but again, because it's going twice as deep as traditional microneedling, and it's putting that burst of heat in that skin. So with traditional microneedling, you may more if you've got some issues and you don't have RF, but the RF is going to tighten and address that texture. In the skin.
It's all
So
determined in a consultation.
exactly. So
Yeah.
everybody's different. Your skin's different than your sister's skin. So
Right.
you will
Right.
not get the same treatment. So we base your treatment protocol in your at-home care, which is like your diet. So we're going to recommend specific for you to your skin.
Here is a question about losing some weight after pregnancy from the microneedling RF, I'm assuming be a good option for skin tightening versus tummy tuck. You definitely have to be the right candidate. There are some people who just flat out need a tummy tuck. There are other people who get a tummy tuck and they might have a little bit of loose skin. So that definitely is patient dependent.
And we've actually treated some of Dr. Draper and Dr. Harper's tummy tucks with the RF microneedling just to improve the quality of the skin around the belly button, so we can combine that, with the tummy tuck.
Sometimes there's not just one magic wand. You may need a little bit bobby boo for a few things.
Right. And tonight we do have a special on the RF microneedling. So for a package of 3, for neck only is $14.99, and with that package of 3, you get 25% off of your neck firm advanced.
Yes.
So that is one of our specials tonight, and don't forget that we have 20% off of our skincare products. And we also have free Latisse with a purchase. So you get a free 3 milliliter with the purchase of 2 5 milliliters of Latisse. Let's see.
Our laser hair reduction.
Yep.
There's a video that you guys can go to check up on that. Now, traditionally, it has been very painful. I've got so many people that have consulted me and been so dreadfully afraid of treatment. This doesn't hurt. I've had people ask me, "Are you ready? Are you ready? Okay, go." And I'm already treating you. They're already firing. So if you have hair that needs addressing, we can help you get it clean, free, a little prickle. So watch the video and ask us questions.
Melissa again, and I'm here to tell you about our Modus AX laser hair reduction machine. This is a new laser to us, and the technology for the Alexandrite lasers has really progressed. This little tip here is where the light is delivered. It's turned to heat, but you don't feel it. This is so great. This is a game changer for laser hair reduction. So this can treat all skin types, most hair types, except, like with all lasers, no white, no red, no blonde. It can't treat that. About 6 to 8 treatments. It's super fast. Literally, we put some gel on, rub it around the area, and usually in under a minute and a half, that area is treated. You come back accordingly to the hair growth, but you'll love it. This is so super easy. It's so quick. It does not hurt. Scout's Honor, does not hurt. Come see us.
Now, discounts on products, so we are offering a special on TNS. That came up in one of my questions, TNS products by Skin Medica. They are discounted at 20% as well as our other skincare products. So we've got some very good specials on those ladies. And everyone that would need something to help us here with the summertime coming up. Sunscreens are on special, and all of our advanced products.
So tonight we have a little game, a guessing game, to guess the number of dermaplaning blades in this vase. So See how thin, see how little this dermaplaning blade. So look at this face.
Maybe
It's very deceptive.
But whoever guesses and gets closest is going to win dermaplaning with a free chemical peel and then over $400 in product. So good luck.
Nice. So people always wonder if they should continue medical grade skincare in the summer, and the answer is yes. You definitely need it. Your pores are getting more clogged. It just seems
Sun damage.
yeah, you've got to come in and continue treatments. There definitely are treatments that you need to lay off of, like some laser things, but you definitely want to keep up the peels. Some of your favorite treatments in the summer.
Yeah, so I love the new Diamond Glow. You know, that you can infuse vitamin C and braid over the skin at the same time. I love Sensi Peel. I love the 2% lactic. So we have a ton of treatment for summer. So don't quit coming just because it's summer.
And the new RF treatment, RF microneedling, is not totally sun dependent. So yes, just don't come in sunburn.
Yeah, right. For sure, yes. And make sure that your sunscreen is up to date. Don't use last year's sunscreen because what that means is that you didn't use enough. Throw that in the trash, start all over, and we'll sell you a fresh one at 20% off.
Yes, come in and get your antioxidants to layer over your sun protection for the summer for the best protection.
We're going to take a couple more questions.
Melissa wanted to know, she just purchased the product 2 hours ago. Can you get that discount? Yes, give us a call.
Yes.
We will help you out with that. Thank you for coming in today.
Oh, I'm seeing some numbers on here on the
wow.
blade.
Yes.
Oh, somebody's real close. Real close.
Yes.
Really close.
There's some other questions we get back in our rings a lot. Goodness gracious. There's so many. I'm sorry, I'm drawing a blank. Make sure you check your expiration of your sunscreens, by the way. They do become less effective after about a year to 2 years. So don't let them just be sitting in a beach bag.
So keep the questions coming. Thank you so much for joining us, everybody. Grab a glass. And I'm going to introduce our next set. Cheers to everyone. Cheers.
Cheers.
Thank you so much.
We appreciate
So
it.
next we have our nurse injectors. We have Linda Owens. We have Kristen Hall. And we have Terry Trudnow.
Amazing.
We are your 3 expert nurse injectors, and we have decades of experience. I'm Kristen, this is Linda, and she's our national Allergan trainer, and this is Terry.
So together we have lots of experience. We're not just any injectors. This is our expertise. This is what we love to do. We love injections, and we get to do injections all day. We know anatomy, and that's important when you're choosing your injector. You want someone who does know anatomy, and not only that, no patient's the same. No anatomy is the same, and your desires are going to be different as far as the outcomes that you want from the next person. And so when you come in, we do full face assessment. Each treatment's individual, and it's not a cookie cutter treatment. So we're going to do a Botox demonstration. Terry's our patient tonight, and you'll get to see. I think Kristen's going to inject. And we'll tell you what we're doing. It's going to be exciting. We're glad you're here with us. Again, we look forward to seeing you, and your treatment's going to be individualized and professional.
Hey everybody, okay, so we're here and we're going to do Terry's Botox. I'm going to mark out where I'm going to go, and sometimes we do that for our patients.
The first area Botox got its FDA approval was right there, the glabella. That's that muscle that pulls in and sometimes makes us look concerned or angry. It can tend to make us look a little unapproachable. So Botox weakens muscles. When we weaken this muscle, Terry will not be able to scrunch and frown. This is the frontalis. It's responsible for raising the brows. Raise your brows real big. So when we weaken that with Botox, that forehead's going to be nice and smooth. It already is nice and smooth because Terry has been getting her Botox for
Long
a
time.
long time. So we're kind of Botox junkies, right?
Yeah, we are.
Choose your poison. This is the orbicularis oculi muscle. It's a sphincter, and when you squint and smile, it scrunches up that skin. So when we weaken that muscle, she'll still smile.
yeah.
We'll just smooth it
So
up.
pretty. It's one of the
I just love it.
Yeah.
I love it.
It opens up the eye a little bit because this muscle right here is a depressor. It pulls down and it'll lift. So Kristen's injecting the corrugators, those muscles that pull the brows not only in but down. Remember, Botox weakens muscles. So that's going to give her a little lift on the brow right there. Beautiful treatment. She'll see results in about 3 days. She'll start loving it in 3 days, but 2 weeks from now when it fully kicks in, she'll get full result. And so that Botox in the frontalis muscle, that's not going to raise her brows. It's actually going to weaken those muscles so that she does not have the horizontal lines there. And then the crow's feet,
Let's just do one little loop over here.
a little drop there.
Spread the love.
Botox is customizable, not
Yeah.
Right.
not every patient's going to get treated with the same amount of units or the same areas. And when you come in every 3 to 4 months, because it's FDA approved to last 3 to 4 months, when you come back in, we may change up your treatment. You may have cut your bangs, and so you don't need forehead Botox.
Right.
Or it's the summertime, the days are longer, we're
Can we do
outside
more
scrunching more. We
crow's
might
feet?
need more in the crow's feet. But you'll love your Botox.
Yeah.
It'll be
And we always have you
customizable.
come back. You know, in the
Right.
beginning, we have you come back in a couple weeks because we want to check it. We want to make sure it's the way that we want it. And sometimes you have to do a little tweak, and it's not a big deal.
Yeah, we want you to love your Botox.
Yeah,
We
right.
feel confident that you're going to love your Botox. These areas are on label, but there are also some off-label areas that we do that's really lovely. The lip flip, we'll do that in just a second. It weakens the muscle right around the lip, which is also a sphincter muscle.
Yeah, we'll do
And
that.
so it just,
Okay, relax.
4 little teeny sticks is all it takes. And it's called the lip flip. It doesn't give you big old lips. It doesn't turn your lip inside
Patients
out.
love it.
It
My patients love it.
just weakens that muscle.
Mm-hmm.
Am I doing the crow's feet?
Yeah, and I got some extra.
And smile big, relax.
And you can also do, when we're doing the crow's feet, a lot of times, you know, you'll squint up a little bit here, and sometimes people have these little bunny lines. They name it something cute, but
Yeah.
we want to get rid of that. And so that's another off-label that we
Scrunch
can
right
do.
here.
Yeah, sure.
So the bunny lines, if you've had Botox everywhere, your crow's feet, your forehead, the frown line, and everything's nice and smooth, but you see in your pictures that you still have a scrunch there, we have a Botox Relax. We have a Botox for that. That's just a treatment of your bunny line. And so
Really
it's
do.
cute for Easter, but not the rest of the time.
And look, here too, we can help in the chin. So you can get that textural change. You know, they call it like the cauliflower chin. So we can
Smooth it out.
Smooth
Very
it out.
nice.
It's a lovely.
3 little teeny sticks right
Yeah.
here is all we need. Can I have a gauze? Can I have one of your gauze?
Oh yeah, yeah, babe.
Easy peasy.
Now also, you guys have probably heard of tech neck. That's when we find ourselves on social media,
Yeah.
and we end up getting these horizontal lines, you know, on our neck. Botox is great for that. Actually, Botox is great for a couple of areas on your neck.
Yep.
For platysmal bands, it will weaken those bands and smooth that out. And also for the horizontal necklace lines or the tech neck, we do that there too.
We can also do Microtox, which is a super
Great.
diluted Botox, and we go in really superficial, and we can do the whole neck. And it's not a neck lift, but what it does is it smooths out the texture, tightens it a little bit. It gives it a little bit of a shrink wrap appearance. And so a lot of patients love to add that on after they've done their face.
It's that Microtox is also great for the lower lids. This skin is the thinnest skin we have, and so if we can go in there with tiny little dollops of Botox, it will soften that lower lid. So Microtox, lip flip, on-label Botox, we feel like you're going to love it.
Yeah.
Give it a try. We have it on special if you're joining us now, and so it might be an opportunity for you to try a new area.
Yep.
Happy Hobby Night. I'm Linda. This is Kristen and Terry, and we are your 3 nurse injectors. So if you have any questions at all, just shoot them to us. We're going to try our best to get to them. We have amazing specials tonight. The first one is Botox. If you purchase 20 units of Botox,
23.
Yeah, 23.
Try me twice.
Yeah, that's right. So what,
It's the time to do it.
what if you're, you think, oh, I don't need 20 units, that's a lot. I don't need 40.
I don't
That's
need
a
40.
lot.
Yeah, what am I gonna do with 40 units of Botox?
The recommended dosage of Botox is 20 units for the labella, which is the 11 rounds, 24 units for the crow's feet, and 20 units for the forehead. Now, that's not enough for me, y'all. I'm no animator, I got 5 head, I need a lot.
Yeah.
But if you haven't thought of an area, what about, well, you just saw our video, and so Sherry, we treated
The
her
whole thing.
labella, forehead, crow's feet, lip flip, chin. That's a yummy
Trying to
thing.
see out. This is gonna burn a little bit. Show.
That's really
So
cool.
if you're just doing 25 units, 35 units, it would be 4 units, will give you an opportunity to try this, especially if you're only doing your clean your brows, forehead, you haven't done your protein yet, summertime's coming, we're all longer. Squinting. Yeah, squinting, now's a great time to add that. You need to try it. Yeah.
The days are longer, you're out with your friends, with your family, so try Botox in the crow's feet. Someone asked about lip lines, and one of the treatments is Morpheus with our estheticians. They are so amazing, they do a great job. And Morpheus will smooth that, but also the lip flip, and y'all, that's a popular little phrase that's going on now, right? But we still like the lip flip.
It does such a wonderful job.
It's easy, but it's gonna, remember, Botox weakens muscles. And so if we can weaken the scolpicularis muscle around the mouth, just like a sphincter, if we can weaken that, it'll soften those little lines. A true lip flip though is not just Botox, but a little bit filler too. And
That will also help the lip.
oh, our other special,
Yes.
filler.
Filler.
If you buy 2 syringes of Juvederm, you're going to get $100 off. And we have a lot of questions, or a lot of times people will ask, I don't know if that's the Ducky or Dawn. Juvederm is an awesome product. It's FDA approved to last anywhere from 12 months to 2 years.
Yeah.
And we have a toolbox of Juvederm.
We have a couple
products to
different,
use.
and people are always afraid that they're gonna be too big. Oh, it's big, I just want to hold so,
Yeah, here's the thing though too, you have to get through the slime.
Right.
If you do filler, 3 days of slime, 80% of the
Right.
slime is 3 days. Then residual, 20% of slime is over 2 weeks. So you can't call the lip police
Right,
until 2 weeks.
but it's under our control how much we put in.
Yes.
It's, it's between patient and injector, what we do. So it's customized for everybody.
Well, how do you choose your injector? So, y'all, there's a lot of injectors out there, and a lot of really great injectors. And just so that you'll know, we are very seasoned. We have been doing this for many years. This is my 26th year injecting. I'm a national trainer for Allergan. Terry's been injecting for 16 years, and Kristen for 6 years. So we want to see you. And the difference in us, in your treatment, is that it's not a cookie-cutter treatment.
Right.
When you come in.
We listen to you.
Yep.
We're gonna do what you want to do.
That's
We're
really
gonna work
personalized.
with you individually. Like we say, it's customized. You can customize these treatments. Like they said, it's not cookie cut.
Speaking of customization, y'all, we have a great little treat for y'all. Okay. These are empty Botox.
Yes,
Yummy
we do a lot of
Botox. So, whoever can guess closest to the amount of vials of Botox we have in here will win a totally free, complimentary, customized Botox treatment. Customized Botox treatment. Not everybody's the same. You might need your crown line. Well, you might need your crown, your forehead, crow's feet. These are all on label. We also do off-label treatments. The lip look, the chin, which softens the little orange peel texture. Masseters. When you have to grind your teeth, these masseter muscles are really strong. Remember, that weakens muscles. And so if you can weaken those, you're not going to grind your teeth as much. It can slenderize the face.
We can also microtox, which is a super duper Botox. We can do a little bit on the eyes. We can do the whole neck.
The new thing, technique.
Yeah.
Well, that's a big thing now.
Botox,
And
microtox.
Yeah.
Also, I want to get back to our specials on the filler. A lot of people think, oh my goodness, I only need one syringe.
Right.
Well, guess how much is in one syringe? A fifth of a teaspoon. So it will take 5 syringes to have even a teaspoon of product in your face. When you leave here, you're not going to look funny or distracting or dumb. Juvenile Voluma is great for the cheeks. Not only does it fill, it's going to give you a little lift. It's lovely. It lasts for 2 years. Juvenile Velour is beautiful in folds and corners.
Yes.
Volbella is pretty for the lip lines. So all of these areas can be treated with Juvenile, and I can assure you, you are going to love it.
We're going to set you up in a place where you're ready to start.
Right.
Ooh,
Some people
we're here to guide
guys
you
to this.
Yes.
So it's
Oh,
less
girl.
than 400.
Yes.
More than 100, less than 400. And good luck with this. We're so excited to see you. To take advantage of the specials, give us a call tomorrow, 704-375-7111, and schedule your appointment with one of us. And take advantage of the specials. Buy $20 of Botox, get 20 units of Botox, get 20 units free. Buy 2 syringes of Juvenile, get $100 off. And we are so excited to see you
We can't wait to see you.
and to treat
Oh.
you.
Hundred and 400. Is that right, ladies?
It's less than 400.
Less than
More than
400?
100.
More than, so between 100. So the people who are guessing 65, 86, 79, go a little
No.
higher. Go a little higher, right? Okay, great. All right, so we are going to wrap it up. We've got about 10 minutes of questions that we're going to try and answer. Take a look at all the specials. I think it's listed, I'm sure, on our Facebook page. I'm sure it's gone through this
Maybe even
multiple
now.
times. Right.
Overview.
Right. So we're going to follow up on some other questions that we didn't get a chance to get to. So you went over the neck lift and when you think you're a good candidate for that. I'm trying to go up higher to this.
How about eyelids? Let's see. I mean, somebody asked a question about eyelids and, when do you do your eyelids versus when do you do your brow? And it's an easy answer. Right. If your brow is in good positions, then any skin in your upper eyelids is just that, eyelid skin. But if your brows are low and you have skin in your upper eyelids, you may have eyelid skin, you may have brow skin, or you may have both. So that's just needs to get looked at. It's an easy test.
It's a good question. And one is, the larger the implant, if you have it subglandular, will that mean that a need for a lift is in your future? So great question, all kind of relative things. And there's actually been a study recently in the last month or so that's looked at upper pulse stretch with subglandular augmentations, right? Meaning how the distance between your sternal notch, which is this little groove right here at the base of your neck where your breastplate starts, and your nipple, because really you don't want that to stretch out too much. You don't want your nipple to start going south.
Can you say nipple?
You can say nipple now.
Okay.
But only if we hashtag it, I think.
Hashtag
hashtag nipple. So your hashtag nipple You don't want to start going towards the floor. We all know that, right? That's like plastic surgery 101. So it is only, it only makes sense that the larger the implant, the more weight there is with the implant, the more it's going to have a physical effect on your tissues, right? But it's all relative. One is how great are your tissues already? The other is how large of an implant are you really talking about? And the third is kind of like what I close my ears to when patients come in and say, I can't wait to get my breast augmentation, or I can't wait to get my breast lift, or I can't wait to get my breast reduction, so I never have to wear a bra again. And I'm like, what in the world? Like, bad idea, Genes. You always want to support your investment, especially now, right? Like on a long enough timeline, if you get Tom Hanks Castaway, things probably aren't going to look that great, right? Like gravity always wins. There's a great line in a Radiohead song that says that gravity always wins.
So what's the biggest implant you've ever put in?
Oh, well, I mean, I've put in the largest made, which are 800cc implants. Now, caveat to that, the 800cc implants that I've put in have been in breast reconstructions. So that's when a woman loses all of her breast tissue. And so while that sounds like a large implant, obviously this was someone who had the width of their chest to support that. Mm-hmm. An 800cc implant is going to have a base width of 15 centimeters. I'd say the majority of my cosmetic patients who are looking for breast augmentations, maybe 12 and a half, 13 centimeters. So I would never offer them that implant. And that's also the most projecting implant.
So do you tell patients who come in with a set of anatomy that'll allow them to do 300, 400 cc's, and they want to be bigger than their anatomy allows them? Yeah. What do you tell them?
I tell them I'm not their plastic surgeon.
I think that's a great
and that's after kind of telling them, here are the reasons behind this, right? It's not just, oh, I'm not your guy. I mean, I want to be their plastic surgeon. You want to be their plastic surgeon, but you also want to do what's right for them. And you can't have patients come in and kind of dictate things that are going to get them in trouble, because ultimately,
you know where they're going.
You're going to have to fix the problem, or that problem, you're assigned to it. And we don't want that for our patients. We don't want that for our practice. We don't want that for ourselves. And we just want to hopefully educate the patient on the right thing to do. So,
so you're telling me that everybody can't have necessarily anything they want in a breast?
Oh, 100%.
Okay.
And if anybody is willing to do that, if a plastic surgeon is willing to put whatever implant you say, I want an 800cc implant, and you're this 5'1", 95-pound frame, that's irresponsible, that's negligent, and run from that plastic surgeon.
Yeah, and I would say that we are not the breast police. And if you want something and we tell you it's a bad idea and you still want to do it, because we're not the breast police, we would consider doing it, because it's easy to fix. Take that implant out, put the appropriate size implant in. But let's say you're doing something on the nose and you want a very concave nose.
Right.
And you think you like it, and we show you pictures of it and you like it, and we think, this is really a bad idea, and you still do it. Well, we're not going to be that person to do it, because it's very difficult to fix that overdone nose. Whereas an implant that's 200 cc's bigger than you want is relatively easy. You're young, you haven't had it in there that long, the skin's not going to stretch out that much. You can just take it out and put another implant in, but it's more expensive. So we're going to help you avoid that mistake by saying your anatomy will allow this much within these parameters, and we hope you pick that.
Right. And I almost always give, a range to every patient, right? And it's not always, you can choose whatever profile you want. That profile is what gives you kind of from the side, how much va-voom factor do you really have? The projection that goes out. But if you start going with a really wide implant, every time you swing your arm and walk, you're going to be bumping into it.
And why do they have to have a really wide implant? The volume.
Yeah.
If you go too big, you got to have a wide volume.
That's exactly
a wide implant.
That's right. That's right. And so you typically want to choose implants according to the measurements of the patient. That's why we take these measurements. It sounds kind of funny when we get out a tape measure and start, reeling off all these numbers, but that's just anatomy. To make sure that we choose the right implant for our patients. Another question was about connective tissue disorders. So that probably you see more in facelifts than I might in breast, but it goes in different things, right? Like there's plenty of different connective tissue disorders. Ehlers-Danlos. There's other ones that are contraindications to cosmetic surgery that we just never would. So it really depends, scleroderma, some of those different connective tissue disorders. It depends upon which ones you have. And then, we can kind of help gauge you on which procedure you're talking about before we start just saying, we don't deal with any connective tissue disorders, because there's a bunch of different ones.
We need to have an understanding of the disease process and see if it is impacted by the cosmetic surgery we do, because we don't want to do any harm.
Yeah.
And if we're not sure, we get medical clearance from the physician treating the particular disorder, and that either is a go or a no-go.
Yep.
So it makes it pretty simple.
So pretty common, and this may be the last question, how many weeks off before going back to work after a lift and augmentation? So briefly, I tell almost all of my surgical patients, so we may have a little bit different post-operative care plan. I say 95% of complications after surgery are within the first 2 days, and 4.5% of the remaining 5% happen within the first 2 weeks. So for almost all of my surgical patients, no matter what it is, I say for 2 weeks, you're going to chill out. You're not going to do anything that gets your blood pressure or heart rate up too much to where you would sweat or anything like that, because I don't want any excessive bruising, bleeding. I don't want you doing too much.
Or a trip back to the operator.
That's exactly right. And then at 2 weeks, you can start to exercise. Walking is an exercise. At 4 weeks, you're jogging, elliptical, back to some light yoga, maybe using the blocks and things like that. And by 6 weeks, you're doing a double backflip off the second.
Squats.
Yeah, and squats. And by the 6th week, you're doing everything. You're 60% healed at 6 weeks, 80% healed at 8 weeks. And if you want to go do a gainer off the second floor of the dock at the lake, go do it. Right?
that.
Good. Well, we appreciate everybody participating in this tonight. Hopefully everyone enjoyed their favorite cocktail. Hopefully they got some of their questions answered. I'm sure we haven't gone through everything, but we're here to answer your questions. We'd love to see you in consultation. Take a look at all of our different specials that we're running, and we really just thank you.
Well, and I think consultations are free.
Yep.
If you can show us that you logged in and we know you're a follower, then we'll be happy to answer those questions.
Yep.
And we'll do a better job in person in your specific sets of anatomy and physiology and goals.
Yep.
We'd love to see you.
Yeah, they stole my coffee, but otherwise we would cheers. He's got a nice blend lemon. I had
it's a nice
I had a
apple
Keurig
juice.
coffee. Yeah, I had a
Really good
Keurig
apple
coffee.
juice.
It wasn't quite as good. Good night, and we hope to see you soon.